Hello, I'm Dr. Emma Hint-Nichols, and this is my weekly AMA Manual of Style Guide tip that I hope will be useful to medical writers and also our clients at Nascent Medical. Please share this with your colleagues if you find it useful. Thanks. So today I'm talking about age and gender. Actually, the preferred term is sex, as described in the AMA Manual of Style. We'll cover two subsections. They are both in section 2, the section on style, and subsection 11, correct and preferred usage. One section I will discuss 11.5, age and sex reference. The second is in 11.10, which is inclusive language, subsection 11.10.1 and 11.10.3. For age and sex reference, the manual says to use specific terminology to refer to person's age. So neonates or newborns are persons from birth to 1 month of age. Infants are children aged 1 month to 1 year, 12 months. Children are persons aged 1 to 12 years. Sometimes children may be used more broadly to encompass persons from birth to 12 years of age. Adolescents are persons aged 13 through 17 years, and they may also be referred to as teenagers or as adolescent boys or adolescent girls, depending on context. Adults are persons aged 18 years or older and should be referred to as men or women. Persons 18 to 24 years of age may also be referred to as young adults. Note, if the age of an individual patient is given, it may be expressed as a mixed fraction, such as 6.5 years or 6 years, 6 months, but when age is presented as a mean, the decimal form 6.5 years is used. Whenever possible, according to the manual, a patient should be referred to as a man, woman, boy, girl, or infant, not as a male or female. Occasionally, however, a study group may comprise children and adults of both sexes. Then the use of male and female as nouns is appropriate. Male and female are also appropriate as adjectives. Now, sex versus gender. In subsection 11.10, inclusive language, point 1, the manual points out that sex refers to the biological characteristics of males and females. Gender, however, refers to more than sex and serves as a cultural indicator of a person's personal and social identity. Sex-neutral terms that avoid bias, suit the material under discussion, and do not intrude on the reader's attention should be used always. So, for example, you would say chairperson, not chairman or chairwoman. You would say the history of humankind, not the history of mankind. Terms such as physician, nurse, and scientist are sex neutral and do not require modifications such as female physician or male nurse unless the sex of the person or persons described is relevant to the discussion, e.g. a study of only female physicians or male nurses. Sex-specific pronouns should be avoided in cases in which sex specificity is irrelevant. Do not use common gender pronouns such as s/he, she. Reword the sentence to use a singular or plural pronoun that is not sex-specific, a neutral noun equivalent, or a change of voice. Or use he or she, him or her, his or hers, they or theirs. So you would avoid the physician and his assistants try to vaccinate the patients as quickly as possible. Instead, you would say the physician and the assistants tried to vaccinate the patients as quickly as possible. Avoiding ageism. This is discussed in section 11.10.3, and it's inclusive language as it relates to age. The manual defines ageism as discrimination based on age, either young or old. Because the term elderly connotes a stereotype, it should not be used as a noun. However, when referring to the entire population of elderly persons, use of the elderly may be appropriate, such as the impact of Medicare policy changes on the elderly, for example. Otherwise, terms that are preferable include older persons, older people, elderly patients, geriatric patients, older adults, older patients, aging adults, persons 65 years and older, or the older population. In studies that involve human beings, age should always be given specifically. Researchers studying geriatrics may use defined terms for older age groups, e.g. young old, usually defined as 60 or 65 to 70, or old, which is 80 years and older. Adultism is described. It's a form of ageism in which children and adolescents are discounted, and that's not to be confused with the term adulting, a favorite term of millennials and not in the manual, which is to do grown-up things and hold responsibilities such as a 9-to-5 job. Well, that's it for now. If you need medical writing help, please check out our website, which is nascentmc.com. And if you're interested in getting into medical writing, then go ahead and check out 6weekcourse.com. That's numeral 6weekcourse.com. All right, thanks so much.